Thank you, Lindsay. Now at 5, nurses say they need help, and a new bill introduced today in the state is trying to do just that. This bill creates incentives to try and drive more people to the profession and keep them in it. 10 TV's Colin Dorsey joins us live now after talking with lawmakers and Ohio nurses about this bill. And Colin, I guess, what do they say is the actual problem?
Right. Well, more than 100,000 nurses have walked off the job over the past couple of years. That's according to a study from earlier this year from the National Council of State Boards of Nursing. And without that many new nurses coming in, that leaves the nurses taking care of you to pick up the slack.
We need nurses. We need people that know what bedside nursing is. It's not just because we're an RN we go in and pass medicine. It has nothing to do with that.
For many nurses like Jacinta Tucker, nursing is about compassion just as much as it is the medicine. But short staffing has nurses in her Tuscalora County Hospital and hospitals right here in Columbus cutting into that care because there just aren't enough of them to go around.
And what this legislation does for us today, it ensures that we have nurses who are coming in the ranks, who are being professionally trained, who are given the skills and the resources to do their jobs.
With more than 600,000 nurses expected to quit or retire by the end of the decade, Ohio needs to find a way to stay afloat. The bill introduced Wednesday by Democrat Elgin Rogers Jr. and Republican Haraz Gambari attempts to do just that.
I want to make sure that not only are we able to recruit qualified nurses, that we can train those nurses and we can sustain those nurses.
This bill creates minimum staffing standards for hospitals with few temporary exemptions. It also creates a program to cover a nurse's education if that person commits to nursing in Ohio for 5 years. Catherine Henderson is a registered nurse at the James and says even they aren't immune to the staffing challenges. She says having some standards will help keep younger nurses coming back.
Having those legally enforced standards will allow more nurses to feel comfortable to come back to the bedside. They're not overburdened, they're not overwhelmed, they're not stressed, they're not crying leaving their shift or before they're coming in.
Now, staffing levels evidently are a big factor of why nurses leave the job. A survey of Ohio nurses from the Ohio Nurses Association found that nearly 60% of nurses who left the job said they were just overwhelmed with the number of patients they had to care for. Live in Columbus, Colin Dorsey, 10 TV News.